Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
We'll claim your life.
Heads up, this episode discusses birth trauma, medical dismissal, maternal mortality, and racial disparities in healthcare. Please listen with care. Picture this. You're 39 weeks pregnant, you've packed your hospital bag 3 times, you've watched every birth video on YouTube, and you think you're ready. Then labor starts and suddenly you realize no one actually prepared you for what happens when you walk through those hospital doors. Or worse, maybe you've seen those viral videos recently. 2 different moms were dismissed by hospital staff while in active labor. One of them gave birth in her car 8 minutes after leaving the hospital. And one mom went to the hospital and shared that she couldn't feel her baby moving, and instead of getting the care that she deserved, she was discharged home. And now you're thinking, wait, how does this even happen? How do I make sure that this doesn't happen to me? The truth is, most of us arrive at the hospital for one of the biggest moments of our lives without really knowing what to expect, what's normal, or how to speak up when something doesn't feel right. Today's guest is a labor and delivery nurse with over 10 years of experience who made it her mission to make sure every person walks into their birth experience informed and confident. If you're new here, I'm Dr. Bayo, your health advocate. I'm a board-certified family medicine doctor, and I bring the work I do seeing patients with me on the news, on social media, and here on this podcast. This episode is deeply personal to me. If you know much about me, you know I nearly died shortly after giving birth, and it's a big part of why I do this work now. Today, I'm joined by Tina Bitangcol, better known as Mama Nurse Tina. Tina has been a registered nurse for 17 years, with 13 of those years dedicated to labor and delivery and women's health. She's also a mom of 4, and get this, a stand-up comedian. Since 2022, Tina has been educating millions of people each month through her social media, sharing evidence-based information about pregnancy, birth, breastfeeding, and postpartum care. She's making sure everyone has access to quality information about what really happens behind those delivery room doors. Tina, welcome to the show.
Well, thanks for having me. I said 17 years and I don't look a day over 20.
No, you don't. No.
I started very young.
You started very young. Well, you look great.
Straight out the womb and right into nursing. We don't have time for aging. Let's just get to the good stuff.
Let's just do it. All right.
Mhm.
Well, I normally ask this question, but I assume the answer is going to be yes. But for formality, I'll just ask, are you game for rapid fire questions?
Love a rapid fire question.
Okay, let's do it. So what made you fall in love with labor and delivery?
You know what? People in emergency, they always run away from the pregnancy stuff, but I always ran to it. I loved it. And so even now I've seen so many births, but I still get really distracted because you watch it happen and you're thinking, how is this happening? It's one of the coolest things. And I think it's neat that every person in every situation is different. So it's a really great place to nurse.
Stand-up comedian and labor nurse, do patients get jokes during contractions, or is that reserved for after delivery?
I would say depends on the person. I'm not going to be for everybody. I think we know that. We're never for everybody. Some people love it, but a lot of times if somebody is in labor and they are unmedicated, you'll really see that personality shift when things get real, right? So you can tell, you're like, this is not the time. This is not the time for jokes. It's
personalized medicine, you kind of have to see how that person is. With 4 kids of your own, what's one thing you wish someone had told you before your first birth?
Oh, that's a good one. That they're not going to go the way you think they're going to go, but that doesn't mean that it's not the way it's supposed to go.
That's really great advice because we all have this picture perfect kind of plan. And when we deviate from it, it's like, oh my gosh, everything's fallen apart. But if you allow grace to the fact that, okay, it didn't happen that way, but there's still positives there, that's a way to make yourself feel better in that moment.
Totally. Jen Hamilton, who's one of my favorite labor delivery creators. She's a lovely human as well. Get her book. It's coming out. That's a plug for Jen. You're welcome. Anyway, she said something along the lines of a lot of people don't want rain on their wedding day and you plan for everything except for rain. And then if it rains, a lot of people are like upset that it's raining, but in the end, you're going to look back on it. Those pictures are going to be magical. And then in the end, you still got married. And so those memories, they're different than you thought they were going to be, but they're still your memories to have.
And that's when you can really take it in. So I love that. And I love Jen Hamilton. She is amazing. I
lovely.
agree. So yes, everybody pre-order her book. She is truly a phenomenal human being. So, okay.
Yes.
What's the most common misconception pregnant people have about labor?
That it's going to hurt and that's just the way it has to be. I think there's a difference between pain because you're injured and pain with purpose. And so I think a lot of people are really scared. This is going to be the worst thing ever and we're just going to get through it. But I think you can refocus your brain to be like, this is pain with purpose. I'm not sick. I'm not injured. This is something that my body can do. Yeah. So I think if you sort of feel it with that pain with purpose is kind of a nice way to put it in your mind.
That's beautiful advice because that helps you stay focused on, okay, there is an ultimate gain from this.
Yeah.
That's huge.
Yeah, and
it.
each wave of pain, like technically, is bringing you closer to your baby. So with each one that you get through, it's like a little closer.
Right. Versus like this wave of like, I'm in the dark void of like pain coming over me.
Yeah, my leg is broken in a 90-degree angle. That's why it hurts, because there's something wrong with me. Whereas you're like, wait, this is like pain that's bringing me closer to the end goal.
So tell us what sparked Mama Nurse Tina. What made you take your experience from the bedside to social media?
It's interesting, right? Like when did we make the leap? Like how long have you been on socials?
I have been, I believe it's like 4 or 5 years, like heavily.
Yeah. Okay. And I think a lot of us in healthcare usually have the same goal. And it's like, we just want that accessible, equitable care for everybody, like regardless of who you are, where you come from, how old you are, how much money you make. You want to have these sources of information that are good quality information available to everyone. And that's sort of where it came from. I think most healthcare creators will put something up that has to do with their field of medicine, their field of nursing, and it'll take off. And then you realize like there is a huge need for this information out there on social media, and to be able to provide it, I really enjoy it. It's been really rewarding.
I agree. When you're able to truly meet people where they are, which is on social media, and then the ability to be able to get the information wherever you are versus going into the clinic, getting a pamphlet, reading it, and all of the steps that have to happen. But now
no one's reading those pamphlets.
No. I would like to give a PSA. Please stop making pamphlets. Please
stop. No, especially after birth. After birth, we give you literally like a stack of papers like this big. So I always go over the key points with them. And I say, just take this and put it away when you get home. Eventually, you'll be ready to read it. But please, like, there's so much happening. And then you're like, here's a year's worth of reading on paper. And you're like, I cannot get into it.
You're like,
and I read a stat that like 40% of people are getting their healthcare information from social media and technology now, which is mind blowing. I do have to say, though, I think social media is a bit of a double-edged sword because it's so good in that we can have this amazing information available to everybody, but it also adds to that like confirmation bias that like if you search something, I always say if you're looking for birth stories and you search up like terrible home birth stories, then you're just going to get like post after post after post of these horrific experiences. Whereas if you post horrific hospital experiences, you're going to get the same thing on the other side. So I think you need to be cautious, I think, of, especially with AI now, like you got to be cautious of what you're taking in because it can really like lend into that if you flip onto the wrong side of social media. So I think it's kind of a blessing and a curse if you don't know how to navigate it.
I agree because it can feed into that. I love how you said the bias because if you have a one-way thought of what's to come or whatever your personal beliefs are, political, anything, it will feed into that. And there's a beauty behind being able to have diversity in the information that you receive because that's how we learn, that's how we grow and expand our knowledge. But if you are just going down one tunnel and fed just one narrative, you miss the opportunity to have new perspectives.
And social media will funnel it. Like it'll be like, oh, you want to know about that? Here you go. Here's the 300 more videos to follow. Right. And I always say like in at the bedside. So you can do that. You can do that for as long as you like, but you're working usually with one person at one time and you're seeing one person's story, which is lovely. But I think too, in doing that, you're only seeing that one population in my hospital, we don't have a ton of Black moms, and those Black moms don't have the same disparities as American Black moms, whereas we have our Indigenous populations where I'm from who see more of the disparities. So in working only in that area and seeing a specific population, like maybe you work twice a week and both of your patients were white, well-off patients, like then that becomes your experience and what you're familiar with. And so I think it's nice. I've done more, I think, more research being on social media and trying to present good information in my time on social media than I did, I feel like, in nursing school. Like I feel like I know more about a vast variety of things now because I'm allowing myself and almost forcing myself to do that work and that knowledge to see other people's experiences and be like, what's that about? Like, what can we talk about there?
It is a good balance when you say a blessing and a curse, because to your point, being able to go outside of what you see in your hospital and have it at your fingertips and see those different perspectives and have that education still spill over to the patients you see right then and there. It's huge. And it also happens in the conversations that you have. But if you are seeing the same thing every day, it really prohibits you from being able to take in those other experiences. So social media does, it kind of opens up a world that you might not have been able to be a part of without it. So there is that balance.
And I always think about like Los Angeles, like if you work at, I don't know, an Orange County privatized hospital, you're probably going to see a very different clientele than if you work at a public center in like Compton or something. You know what I mean? Like it's going to be a very, very different experience. And if that's all you ever see, then, I mean, you'll never have your horizons broadened.
Right. And that's when that doesn't happen. I've never seen that. And so
that's not happening.
That's not happening. That's what we hear. And we even see that in the comments with certain videos. And
100%.
so I lead that with curiosity and I say, well, I'm curious. What is your setting? What is your environment? Because then at least the person doesn't feel attacked. And if they decide to engage in dialogue with me moving forward, I say, so my experience is this. This is what I'm seeing. And then I try to meet them where they are in hopes that we can plug a couple of holes in that perspective so you can be open to hearing new perspectives.
Yep. I agree. It's great.
Okay. So I understand the clinical side of labor and delivery because as a family medicine doctor, I'm so grateful that my residency program really immersed me in being able to do assist with C-sections. I did multiple births. I had to do a certain amount. Now, that being said, you are at the bedside and you have seen over decades of deliveries. I'm just very excited to have you on as a guest. So I would love for you to help our listeners understand what happens from the moment they walk through the hospital doors. And I want to go beyond the medical assessment. I would love for you to highlight, what is it that they'll see, they'll feel, what will they encounter as they come through those hospital doors?
So it's interesting. I think a lot of people don't realize that there's actually a whole like triage unit, and there's lots of things that can happen in between like conception and birth. I think if you've had a previous experience being pregnant and there was like no complications and you just sort of carried on, you had your few appointments with your OB and then you went into labor and you had a baby, that's a very different experience than somebody who is having a concern in their pregnancy or there's a risk in their pregnancy. So you can go to the hospital for absolutely any reason, and I encourage people to do that. I would rather see you and not need to see you than not see you and have needed to see you. So if there's ever concerns in the pregnancy, you can definitely come into the hospital. So usually when you come in, regardless of what it's for, the first place you'll stop is like an outpatient department because you're not admitted to hospital, and you'll see a triage nurse. And very similar to emergency department, he or she is going to ask you, what brings you in today? If it's for labor concerns, we sort of want to know a few things. We want to know if your water has broken. We want to know if baby is moving well. If you're having contractions, are they regular? Because there are different kind of parts of labor where sometimes those contractions, they're coming, but they're not coming regularly. They're not really ramping up. And so that might be early labor, as opposed to if you say to me, I'm having contractions every 2 minutes. I have to breathe through them. I have to stop what I'm doing. And I have fluid coming out of me. That's a very different clinical perspective. So the first thing usually is that we're going to get a little bit of a history. It depends on how you present too. Like we see these two moms like in these videos. You're like, these women are like the first woman in the wheelchair. She's just like one cheeking it off the like that's a clear sign that there's a baby right there. She's sitting on her baby basically. So I mean, somebody like that is going to get a very different experience. Well, hopefully they would just be brought right in and have a baby, as opposed to somebody who comes in saying, I've had a few cramps here and there. My water hasn't broken. So kind of depends on how you present. But you'll be seeing a triage, usually like a bit of an assessment. Maybe we'll listen to your baby, make sure your baby's heart rate tracing is good. I want people to know, too, that sometimes the area that you're first assessed, it might be like several beds with curtains in between them. People always ask me, like, is this where I'm going to give birth? And I'm like, no, at least where I work. There might be places that have curtains between and you're giving birth with somebody next to you. You can always do a hospital tour to see, but usually you have a lot more privacy when you're actually going to have your baby. So we sort of just need to determine what's happening. So you might hear people who are in pain or who are moaning. You might hear people vomiting. It's basically, if you could picture the emergency department for pregnant people, that's basically where you're going to be. And then, you'll be connected to a monitor usually, and you'll have your baby assessed. If you are in labor, then usually what will happen is you will then be admitted, and then you will go to a nicer room with more privacy to have your labor monitored and assessed and kind of figure out a plan of care. You will see, this is something that surprises people, you're going to see lots of different people, lots of different faces when you come in. You're going to see like a triage nurse. Then you're going to see like the nurse that sees you in triage. You're probably going to see your provider. It could be an OB, could be a midwife. They might have a resident with them. They might have a medical student with them. I might have a nursing student with me. You might see a lab tech come in to draw your blood if they need that. So there's a lot of faces in the beginning, which surprises a lot of people because I think that's not what they picture when they come in to give birth. So if you are not into learners, that's okay. People always they're like, I feel bad saying no. If you need to say no, you need to say no. I say, this is your one birth with this one baby. I promise you, if you don't allow them to have a learning opportunity, somebody else will. I promise you, they're not going to leave here and never see a birth. So if you're not into it, that's okay. And then, then you'll be in more of a private room, and then we can really get to know you. We can get to know your wishes for your birth. This is where it becomes a lot more individualized, where you can sort of tailor the mood and the look of the room to be what you need for your birthing experience. You can bring in your own lighting. We can put up a sign that says quiet, so that people aren't blowing in, being super loud and obnoxious, blowing the lights on, that sort of thing. You can have dim lights. You can have a playlist. I say, like, if you need to bring in pictures of things that bring you comfort, maybe you had a pet that passed, maybe a family member that's no longer with you, but you want them in the room, you can bring your pillows, your blankets. This is where you can really make it your own. So I say, triage is kind of like loud and crazy because there's lots of stuff happening at all different points of the pregnancy journey. And then once you get into your room to have your baby, it's a lot more individualized.
It's interesting because you can see when people do come to the hospital and they're looking around and they're like, oh my gosh, who am I meeting next? Who am I going to be talking next? It can be overwhelming.
Lots
and
of
then
in and
it
out.
kind of implodes your picturesque kind of Hollywood feeling of what you thought your labor and delivery would look like. And that leads me to, can you walk us through the stages of labor? Because in the movies, you see one version and you and I know that's not what happens. Can you walk us through just to kind of give people some insight?
I always say Hollywood has done us dirty in the birth space because it's always the same, right? It's like your water breaks, and like 30 seconds later, they're like, ah, and they're like screaming, usually in the back of a cab. They're always in the back of a cab. Like, why? I don't know. Anyway, and then they get to the hospital, they push twice, and the baby falls out. And then the baby comes out looking like a 3-month-old baby because there's like Hollywood, there's like some issues with the labor laws. Yeah. And then they have the baby, they look all amazing, and they have like no belly anymore. And it's just, so yeah, Hollywood has done us dirty. It can take a long time. And I think sometimes in birth culture, and I think some of the issues that we're having with births and birth trauma is that we're rushing things. I feel like maybe we've lost sight a little bit of like how long this can actually take in a physiologic birth. And that's going to depend too on where you give birth. Some sites are super, super busy. And the alternative is that people who are in labor can't get in a room, and it just becomes this cycle of maybe pushing things forward. So in theory, in a textbook, birth takes a long time, which is good because then our body is getting used to it and it is ramping things up gradually and slowly, allowing our body to adjust to the process. So that early part of labor, I always encourage people, if you can stay home, stay home. If you're comfortable at home, that is where you will see probably the most labor progression, is if you are in your own home, feeling comfortable, feeling secure, feeling safe, and having all those creature comforts that you're used to. If you cannot, that's fine too. You will still have a beautiful baby. But I always say, if you can, stay at home. Do the birthing ball, walk around the neighborhood, catch up on your favorite show, binge The Pit, do it because it's so good. Noah, I see you. And yeah, that can take a long, long time because your cervix is going from like rock hard, like closed, Jen says thicker than a Snicker, like it's it's meaty, and you are doing all of that sort of back end work. You're trying to make it thin out a little bit. You're trying to make it soften, come forward. I think we get stuck on the dilation. People are like, how far dilated am I? But there's so many more pieces to it than that. Your cervix is doing a ton of things. So if you can do that, like that 0 to sort of, 5-6 centimeters, if you can do that at home, that's going to really do you a favor when you come in to go from like 6 centimeters on in active labor. So we have the first half and then we have the second half. The second half is when you're doing the most part of the dilating, even more thinning if it's not all the way thin. Baby is coming down into the pelvis. There's about 7 to 8 centimeters. That's that transition point. So if you don't have an epidural, this is where people really start to doubt their life choices. They're like, I didn't want this baby anyway. So we hear a lot of, I can't do this. I don't want to do this. Make it stop. Very normal.
Yes.
This is the most intense part of birth, but it's the shortest part of birth. It doesn't feel short at the time, but it is the shortest part. So this is the part where we really need like that village mentality. We need everybody on board because it's going to get ugly, and it's going to get ugly in a hurry because your body is just doing this immense amount of change waiting for this baby to come out. So that little period of time, we see a lot of vomiting. We see people like, my butthole's going to blow. And we're like, I know it feels like that. It's not going to, I promise. And then you are going to get to the point where you're fully dilated. This is the part that is also, it's intense because the skin of your perineum, the area between your vaginal opening and your bum, is stretching to accommodate baby's head. And we say that you can sort of lessen your chances of tearing if you can push slow and controlled, which is very hard. So practice at home. But if you're able to slow this part down just a little bit, it gives your body that time to stretch and accommodate. And hopefully we can reduce the chances of tearing. But it does feel like burning because your skin is stretching. Your cervix is completely out of the way right now. This is your skin at the entrance. So this part it's intense. It's burning. It's the ring of fire.
Yes.
And then you're going to have your baby. And it's going to be amazing. Yeah, but there's definitely pieces to it. And I think it's a lot of a slower process than a lot of people realize. And it's not a bad thing that it's a slow thing.
When people hear slow, one of the things I often hear is, I don't want to do this anymore, as you mentioned, or
Yes.
I changed my mind. I changed
Yep.
my mind.
Super
And
common. Yep.
and that is happening because, I mean, you have so many
It's
things
so
that
much.
you have lost control. And
Yep.
the one thing that you can say is your voice of like, I don't want to do this. I'd like to stop this from happening.
Yep.
But it's amazing how your body is just like, oh, we're doing this and we
Yeah.
know how to do this. And so
Yeah.
if you can channel that power into being able to control that, it's huge. And that leads me to, with all of your years as a bedside nurse and then as a mom of 4, what things can people do to hopefully help have the best outcome?
I think one of the biggest things you can do that can be done well ahead of time is prepare. I think that knowledge is power, and we spend a lot of time preparing for childbirth, but also consider preparing for things like postpartum and breastfeeding. I really think that if you go into it with, I love a birth plan. I know that there are like labor and delivery nurses that poo-poo on birth plans. I love them. It shows me that you have thought this out, and it's also showing me that you have really like put in the work to like research what it is you want and why you want it. Generally, people don't just toss stuff on there not knowing what it is. They're like, I want this and this is why. So I love it. And I think that going into it with a mindset that is like a strong mindset, but that's flexible, is really, really important. And I think also important is that your people around you, the people that are there in your village, they need to know that birth plan like the back of their hands. Like during transition, that's not the time for them to be like learning learning. Sorry, you wanted where is it on here, honey? Like, that's not. So I say like know the birth plan so that they know like what they can say and when, because as much as I say to people, like, you have to speak up for yourself, when you are in the position of giving birth, you are now a vulnerable human being. You are now in a state that you don't know what that state is until you get to it. Like, there's no way for you to know how you're going to feel when you're in labor until you're in labor, and then you're in it, and it's just happening. So a lot of times people lose their voice. They lose parts of their body. Like, they don't feel like they're in their own body because it's a lot that's happening. You have the biggest hormonal shift of a woman's life happening. You have a stress response. You have pain that you're trying to channel. So I think the people need to know that even though you are a strong human being and you have a strong voice and you have strong opinions, in those moments, they really need to be your megaphone and amplify that for you, because you can lose it. You can lose your voice. And then if the people that are there to back you don't have the same voice, then it can kind of go off the rails pretty quick.
So in that moment of
Hmm.
when your voice is lost and you are
Hmm.
just trying to hold
You're
your stuff
focused. You say
together,
the
yeah,
place.
and
You've
get it
gone to the
together.
place. It's the
Yes.
place that only people go when you're having a baby.
Correct. And once you've gone there, it's sometimes a space that you're just like, oh my gosh. So if let's imagine you have gone to that space and you've got the supportive person that has already read up their plan, so they know how they're supposed to support you. How can they do it in the best way? Because there's a lot of people coming in and out of the room. How do they help support you?
I always say come at it kind but firm. I think if you come at it like we're gonna have an altercation, it's never gonna go the way anybody wants it to go. And I don't love that. So I think people need to know that you're open and you're understanding and you're well prepared, but that you're firm because, like I said, you get one birth with this one baby, and so there's a lot of things that I think people can do. I want them to know that they can always request a new nurse. It's not awesome when you're the nurse that's being requested out, but remember what I said, like I'm not for everybody, you're not for everybody. And that's just part of life. Like no two personalities will get together and be amazing for everybody. So you can definitely like sort of know the chain of command and know that your charge nurse is going to be the first person that you're going to go to if you're having issues with anybody or anything that's going on in the room. So you can definitely ask for a new nurse and no one's going to be offended because like I can probably tell that you need a new, like if you feel it, I feel it, and I would rather you have, because people will be like, it was great, except for that one nurse. And you're like, oh, like, I wish you would ask for a new nurse because I wouldn't want to be that one nurse that caused you trauma in your birth experience. So I think knowing the chain of command is really important. Knowing who's going to be in the room with you before it happens is good. So these are questions to ask your OBGYN or your if you're doing a family medicine that has a specialty in obstetrics, if you're doing a midwife, make sure you ask those questions ahead of time. Ask them who is going to be in the room. Do you have a learner? Because nothing really throws off the vibes of a room when the provider comes in to deliver the baby and is accompanied by like an entourage of residents and med students and paramedic observers. And it's just, you're like, this is not. And then you were in the place, but now you're half in the place and half really distracted. And then that kind of messes everything up. So I always say, know the birth plan, know who is going to speak up when and how, and then know the chain of command, and then ask those important questions beforehand so that you're not surprised.
It helps arm you with, okay, when
Mm-hmm.
you know what to expect, even when there's chaos, and I
Mm-hmm.
was going to say when the shit hits the fan,
Yeah. When the
you
shit. Yeah.
can
Mm-hmm.
you can at least, oh well, I knew this was coming at me,
Mm-hmm.
and there's
Mm-hmm.
power in that as well.
Yeah, yeah, and
And
I think too a really good thing is to let your team, like when you come in, let your team know how you like to be communicated with. There are
yes.
people that don't want to know all of the info, and then there's people who get really anxious if they don't know all the info. So you can say things like, "I want to know all the risks and benefits before we do a procedure," which they should anyway. But some people like they don't want to know, and they're like, "Tell my partner. I don't want to hear it. Tell my partner." You can let them know my partner is my voice, and so please talk to them because I'm not in the space. You can say things like before, again, this is why it's important to get all this out before things really get moving, because I don't really think when you're in transition, when you're in like hard active labor, that's a great time to be telling people what you want. Like these need to be known ahead of time. But you can say things like, if I tell you I need a minute, I want you to pause unless it's medically necessary for us to keep moving forward, because that kind of triggers. I think sometimes we come in as medical professionals who have seen this before, and this is not our first rodeo, and sometimes we forget that there's a person attached to it who it is their first time, or it is their first time with this baby. And so we sort of start to think of them as like a body sometimes when things really get rolling, as opposed to like a human being that has individualized wants and needs and desires. So yeah, you can say like, I want to know everything ahead of time, or I need a minute, or I need you to do this and this before you do this. And it's good to know ahead of time.
And being able to feel like the clinician that you have, whoever is a part
Mm-hmm.
of your birth plan, and I always say part of your journey
Mm-hmm.
because
Yep.
they are privileged to be with you
I
in
always feel
this
that way. Yeah.
moment,
Yeah.
and say, this is what I'm expecting. Is this
Mm-hmm.
something that
Yep.
you are okay with as well? Because if we, as you
Mm-hmm.
mentioned, if we don't gel, let's find out now.
Yeah.
And go from there.
Totally.
Now, sometimes in those moments, you don't know who's
Yeah.
going to be on staff, and
Yep.
being able to realize it's not personal, but it's
Mm-hmm.
personal for me to have the right
Mm-hmm.
person in the room.
I think too, sometimes people will willy nilly on social media be like, well, if this provider's not for you, just find another provider. And you're like, that's not always possible. So I think like having a backup plan of like how you're going to do it and who's going to do it and who's going to say what is good, because it's not always possible. We know too that there are maternal deserts out there in the US. I mean, probably in Canada too, but I know for sure in the US where like the next nearest provider is hours away, and you're not going to do that while you're in the middle of having a baby. So I mean, knowing that if it's an option, sure, but it may not always be an option. I always say it's usually totally feasible to switch out your nurse. There's usually more than one of them, but the person that's going to actually be responsible for the health and safety of you and your baby, your provider, may not be able to be switched out. So knowing ahead of time sort of some maybe some advocacy scripts, or knowing who's comfortable saying what and how you want it to go is good.
Yes, having kind of that practice conversation ahead of time. I've told my patients to role play. And yes, you can't necessarily imagine how much pain and everything that you'll be in. But if you have that muscle memory, a repertoire of what you want to say and just going back and forth, we've all practiced for speeches, presentations. Let's practice for your presentation for your baby. There's something about that. And sometimes I get kind of a weird look, but then after they're like, it came out, Dr. Bayo. It came out like
Yes, totally.
I had it in there. And so
it's a big thing.
It's
most people
huge.
don't like confrontation. And then you add in the fact that it's like now one of the most like intense, important, vulnerable situations of your entire lifespan. And then you're going to put confrontation on top of it. Like that makes a lot of people feel. I wrote out some advocacy scripts for Black moms, but this could be for anybody, really. I have 3 of them I can read you. It says, I hear you, but I'm still concerned. Can you explain again? It's like very clear, like this is what's happening. Okay. My symptoms have changed. I need you to check again. And you can also say, I'd like my support person to help ask questions. A really good one too is, I'm concerned about my safety. I would like this documented in my chart. That usually really fires up a healthcare worker to be like, oh, yeah. And that one specifically, I want Black moms to like put in their pocket. Like that is one that you need to take with you to the hospital. Have it written on a piece of paper, cue card right there. Boom.
Right. And the way it's written, because when I have conversations about advocacy, and I love the way you wrote this examples specifically, because I'll have conversations with other people and they'll say, well, you could just say, do this, do that. And I'm like, first of all, that's not going to work, because as we even talked about in the beginning, you don't want to put this person in a confrontational stage. You want to remove the words you and have we, I, like create this kind of level of partnership. Now, unfortunately, we shouldn't have to do this, but we do. And then if you are from a marginalized community, if you have identities, if you are anything that is outside the norm, you have to work a little bit harder to have that conversation. So I love the way you framed it. Another one is, can you just share a little bit more about your decision making so I can be a part of it? So
absolutely. Yeah, I think it's important. And it is unfortunate that we have to like prep ourselves to, but I mean, the reality is like, I mean, we've seen from these videos, like, yeah, it ain't all there sometimes.
No, it's not. Here's a reality check. According to research, 1 in 3 people report birth trauma associated with their birth experience. That's not only physical complications, it's the emotional and psychological impact of feeling unheard, unsupported, or likely they lost control of their own birth experience. Tina, you see this from the inside. So talk to us about what contributes to birth trauma and what protective factors you've seen make a difference.
Yeah, I am super, super passionate about birth trauma and how we can reduce it. This is something that I like to talk about at conferences, because I think there's this misconception that there has to be this huge traumatic event to walk away with birth trauma, and that's really not the case. I would actually say, from what I have seen, likely it's more of like the little things, and it usually factors around communication. Will those big traumatic events cause birth trauma? 1,000,000% they will cause birth trauma, but it doesn't have to be a catastrophic event for somebody to be like, I feel like that made me feel a certain kind of way, or I feel a little bit off about it, or I feel sad about it. And it's as simple as feeling like something is being done to you instead of done with you. Like you're watching your birth happen as opposed to participating in it. And that can really boil down to like even 5 seconds of additional communication from your healthcare workers. Again, we get in this funk of like, especially in emergency situations or when things are happening quickly, we have our algorithms, we do the things we need to do to like fix the problem, but we sometimes forget that there's a person attached, and not only a person attached, there's usually a support person who is now watching their loved one and their baby in some sort of turmoil, and they can see that their loved one is not understanding or is panicked or is nervous, and then that adds to their birth trauma as well. I really feel like that little extra bit of communication, I always what I try to do in emergency situations, and I talk to people about this all the time, if you can get an extra human being in there, it will go so far. And people are like, well, we don't have the staff. Like, is there an educator? Is there a manager? Like, they just need to be a human that can touch the person who it's happening to, that can look them in their eyeballs, that can be specifically and solely there to explain what's happening and why. And that will go a long way to them feeling like they're involved in the situation as opposed to just having things done to them. I remember my sister, she said she had an emergency C-section, and she said like she didn't know if her and her baby were going to live or die because she was just laying there naked in an operating room. And if you've like, I've never been in surgery. So if I were to go for a C-section, that would have been my first experience in an operating room, which is cold and bright and great. Like, it's just at a different place. It smells sterile. Like, it's different if you've never been there. So for us, we go in and out of the operating room all day long. But like for this person, it might be their first time. And now their first time in an operating room, it's because people are concerned about their baby's health and well-being or their health and well-being. I always say, if you can get somebody else, that touch, that eye contact can go such a long way in them feeling like they were a part of what was happening and remembering that there's also a partner there that needs some explanation as well. Or if you don't have the time to explain to the partner in that moment, you can, again, touch them, look at them and say, we are doing everything we can right now. I will absolutely keep you up to date, but just know that we're here to help so-and-so. I also, when I start my shift, I always tell people, if I'm ever concerned about you, I'm going to try to let you know ahead of time. And if it really comes down to it being an emergency where I have to push this button or pull this out of the wall, there will be a lot of people that will come in the room in a hurry. I'm going to tell you that before I push that button or pull the bell.
That is genius. Just to let them know that if things kind of go the shit, that's going to be our common theme. If the shit hits the fan, this is what to expect. Yeah. And that does allow them to not be this invisible participant as you're bringing life into the world, but you are a part of what's happening. And I agree, having someone in the room to explain what's happening. And if that's not possible, as clinicians, it is on us
we have to
remember that we do have a human being in front of us and to take a beat, take a moment and explain. I sometimes tell my medical students and residents, remember that the person in front of you is experiencing something that they've never experienced before. Just like you said, you've walked these halls, you know what to expect, but they don't. And then I ask them to take it a step further. Imagine that this was you or in this situation. How would you feel? And I think it kind of helps recenter. And I think we need to do those check-ins with ourselves every shift because you just lose it. Like by 8 or 10 hours, you might forget that humanity, even though I believe, the majority of us are out there for good. Like we want to help people, but sometimes with the way the system is built and just how things go, it gets lost, and it's unfortunate.
It does. I find myself, I like to gravitate towards that position where I'm like at the head of the bed because I feel, I don't know, I'm just like, if we can, because you'll see this happen where something is happening. Maybe they go into an emergency C-section, whatever it may be. Maybe they're hemorrhaging. You can see the difference when you are there present with them, explaining things to them, or even if people like, we don't have the time and like, it's an emergency. I get it. It's an emergency. You have 10 seconds. You have 10 seconds to tell them a lot of things are going to start happening right now. There's going to be a lot of people pushing, poking, prodding. I am here with you. I'm just here with you. Like just to hear that. Can I just tell you, Jen Hamilton, so many pieces of her have come into my practice, but one of the most influential things she has ever done that has impacted my practice is if you just look somebody in the eyes and you say, I know you're scared and that's okay because I'm not. It's like suddenly they're like, oh, like, and that works for like parenting, for teachers, it's okay that you're scared because I'm not. Like, then they're like, oh, okay, like you got me, like you got me. And you told me that and you touched me when you said it. I feel you. And it's like they sort of like you see them like exhale almost. But I find that you can see the difference in somebody who's had a traumatic experience, who sort of had somebody there advocating for them, talking to them, keeping them in the know, where it was like, for some people that might've been like, that was an awful experience. I hated my birth. Sometimes that can shift things a little bit to be like, things went really, really wrong. I mean, it wasn't great. I understand why it happened. And you can sort of move forward because we got to remember that birth trauma, you take it with you forever. Like you take it with you through life. Then if you have another baby, sometimes people don't have another baby because that birth was so traumatic or they perceived it to be so traumatic in their life cycle. So like they're going to take that with them in their postpartum journey, in their breastfeeding journey, in their decision to have another baby, in how they parent that child. It's going to affect their relationship. Like it really has a trickle down effect. And we need to keep that in the forefront.
And the invitation to bring your patient into your world, and those words are very powerful.
They're so
And
powerful.
it does,
Yeah.
it just makes you're like, okay,
Mhm.
I know this person has me. And there's something about that.
It's my favorite thing. And you know what? I told my husband, and he works in emergency, and he came home one day and he's like, I used your thing. And I was like, what are you talking about? And he's like, yeah, I told somebody, like, it's okay that you're scared because I'm not. I've got you. He said they just were like, oh, yeah, okay, good. Carry on. Like, he's like, it was so good. I was like, yeah, I know.
I know it's powerful.
It's great.
And sometimes, words are medicine. And I
Mhm.
believe it. It's treatment, it's therapy, it's all the
Mhm.
things.
Yeah.
And that, as we talked about reducing people's trauma, just those words later on, because of what was said, can make a huge difference in that person's overall birth experience or what they remember. And
Yeah.
things could have been terrible where who knows, there was a complication, but because you said that to your
That's right.
patient, it's almost as if that memory wasn't as bad because of that. So now I want to get into the heart of, something that is topical right now. But when I say topical, it's not just topical because it's happening every day. And that is, the viral videos that recently surfaced of two Black moms who were ignored and dismissed. And I know you and I, when it comes to advocacy, it is our love, it's our passion. And it is really important that we highlight what happened first was should have never have happened. But I
Never.
also want to help our listeners understand how to advocate for themselves if they face a similar moment or someone they know, because there's so many roles that people can play. And in those videos, you not only have the mom playing her role, she had her mom there, or in the other video, a husband as well,
Husband,
and
yeah.
the mother-in-law. So I would love to first start off, if there's a mom who is clearly in distress and she's facing a situation where the nurse has her back to her, there's no sort of communication. What is something someone could do in that moment?
I think this goes back to the document everything thing. Like these situations to me, I'm like, there's like not a world in my brain where somebody could sit next to me like that obviously about to have a baby and just like look at my computer. Like I was like, what's happening here? Like, why is this happening? But we know that Black women are more likely to die in childbirth, that you're very familiar with. And we know that they are often dismissed. Their symptoms are not taken seriously. And then on top of that, we have the fact that people who are pregnant who are Black, they have a higher incidence of things like preeclampsia and gestational diabetes and postpartum complications. So you combine all of that with this bias and this racism that still is within healthcare, and it's like a recipe for disaster. And it's like, I don't know. I mean, like the answer is to stop. But I mean, that's been the answer for hundreds of years, right? But we still haven't figured it out. So like, I mean, I would love to flip the script and ask you like, how does this get fixed? Because I don't like, I mean, I think in that moment, they did what they could with the situation that they were in, but I think like taking it further down the chain of command, like that nurse, like that first nurse, that emergency, the redhead nurse, like this is not her first offense with treating people who are in a minority shitty. So I mean, she shouldn't even be practicing, if you ask me. But I mean, definitely, I think going above and beyond her. And also, here's the other thing that I don't understand. I'm not answering your question. I'm just like, yeah. I'm just like, oh my God. Like, in a situation like that, you hear somebody screaming like that in a triage department, as staff members, like you're coming to see what's happening. You're like, who needs help? What is happening? So like, where are the other people? Because if the other people saw that and didn't do something, like they're equally guilty of adding to the problem. So I'm very confused as to how this happened. Like how did nobody, like, I don't know. Cause I could never do it. Like, Yeah, I don't care. All of the things that she was asking could be asked after. I say like birth first, talk later, because you have a baby and then you have all this time where mom is skin to, or should have all this time where mom is skin to skin, where you can ask the questions. And whether she's had her baby or not, the questions of how many babies have you had, how many weeks are you, who's your doctor, those particulars are not going to change because the baby was in and then the baby is out. So you could fill in the boxes later on. It blew my mind. That clip made me so mad. And unfortunately, it's happening all the time, every day. And like, thankfully, these two things were documented so that it can actually like get a proper pedestal like in the social media pages. And so I say I'm not usually a fan of people videotaping healthcare workers, but like now I'm kind of like, no, like maybe more people should tape their healthcare providers, like especially people who are a minority, especially our Black moms who are dismissed and not believed and not taken seriously and are sent off to have a baby in the car 8 minutes later. Like that's a problem.
And that's what I was going to ask you, and I'll answer the question that you raised as
mad.
well. What should have happened?
Oh my God. Yeah.
To your point, when I was watching the video, and for context, for those who are listening who may not have seen the video, you have a Black mom who is actively in labor. You can see her twisting and writhing, and the
groaning,
nurse
like
remains
grunting.
groaning, and
like you can't make that sound up. Like that's I'm having a baby right now.
And the nurse continues to ask, like, how many babies have you? Who's your doctor? And doesn't provide any medical intervention. And
she's not even like looking at her when she's asking the question. Like, it's
When I saw that video, and this answers your question, and there's many things that we need to do to help fix this, but it also starts with and that's why I loved when you said that, where are the other people?
Yes.
Because we already know this is a system failure in general, but that example right there shows that it is a system failure, because you can hear her screaming in the hospital. We are trained to respond to that. We should be coming. We should be who wheeled her in there and just left. So that part is the problem, as well as just this feeling of being numb to someone who is in active labor. And let's go to the other story with the family who was told that they were 3 centimeters and then dismissed. And you can see her visibly in pain. And that example piggybacks on the other one, because you have someone pushing her out.
Yeah. I think there's 2 staff members.
They don't stop. And so I have a question for you on this, and then we'll kind of dig even further. For the mom who was 3 centimeters and was dismissed, what should have happened in that moment?
So what should have happened is when she said she's in labor and this really bad pain, she should have been taken seriously. Like, this is what I say. So, and people, I think this is maybe a misconception too. I think people think that a doctor is always involved in their care, but a lot of times I think labor and delivery nursing is one of the areas where you have the most autonomy as a nurse. Like, a lot of times our intuition and our training is trusted. Sometimes we'll call a doctor and say, this is what I'm seeing on the tracing with baby, X, Y, and Z, or we'll call them and say, I examined her. She's 3 centimeters. She's somewhat. Remember when I said there's more to it than just dilation? This is a prime example. Like, very easily, if your cervix is paper thin, we call that effacement, and a baby comes down on it, that cervix is gone. Like, it's just going to go poof. This happened to me with my 4th baby. I was 6 centimeters. She finally turned and dropped, and it just went away, like tissue paper. Like, imagine punching a hole in tissue paper. It's gone, right? And now you have a baby right in your parent. Like, baby's right there. So I think one time in my life, I made a mistake of thinking that I had just checked somebody, and then maybe 3 minutes later, they were like, oh, like they were like making the sounds, and they were like, oh, like it's pressure. And I was like, you're 3 centimeters. She literally had that baby like 5 minutes later, because I was like, okay, well, I'll check you anyway. But I think we get in this like this space of this is how it's supposed to go, and we don't think about the people who are outliers that could be different. So what should have happened is that she should have been rechecked, even if she wasn't rechecked, even if she was 3 centimeters. Let's say she was 3 centimeters. Like, just to look at her. She's in an intense amount of pain. What is the point of discharging her home, even though she's 3 centimeters, because she's not coping with the pain? Like, so if she's 3 centimeters and in pain, we need to figure out how to get her more comfortable before she goes home. And chances are, if we made her more comfortable, even quicker than 8 minutes, she would have had her baby quicker because now her body is relaxed. Even in the situations where, yeah, technically she doesn't check a box, she's not progressing, which we know that she did. But if she's not progressing and she's not in labor, that still doesn't negate the fact that she's in pain and that we need to help her with the pain that she's experiencing before we just poo-poo and say on your way because you don't check the box of moving on in labor. I was appalled because what is the point of sending somebody home when, I mean, in Canada, they're just going to be back because we don't pay, right? In Canada, I always think if I send this person home, they're going to make it to the parking lot and turn around and come right back up. So I might as well help them right now while they're here instead of sending them home for them to return right away. Also, somebody else, my American nursing friends, they were like, and then those women had to pay for that shitty experience. And I was like, unbelievable.
That is a huge point. Not only were you dismissed and didn't get the care you deserved, but yes, there was, a charge for that visit and it's appalling. These stories were very triggering and but for context, I nearly lost my life giving birth in the hospital that I work at as not only a physician and a medical director.
Oh, no.
And to your point where there's this check the box, well, you don't look like this or this looks fine without going a step further and being really prescriptive to what that person is in front of you. So for me, I had just delivered my second child. I had a C-section. I had one with my first. And it was about 30 minutes later, I knew I didn't feel right. I knew I was having a hard time talking and concentrating. And for anyone who knows me, yes, I am the energizing bunny. Sometimes it might be too much. I might be too much for people. I get it. But I'm just, go, 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 even after having a C-section. Yeah. So I reached out to my nurse. I was told, you look fine. Everything looks okay. Got worse. Reached out again. And I was told, you look fine. Your vital signs are fine. Yeah. And by this time, I know that I can barely speak. I'm feeling a level of pain that I've never felt before. And so I had to reach out I asked my husband to use my phone. Luckily, doctor to doctor, I had his phone number. He said, something's wrong with Bayo. I know something's wrong. And luckily, my doctor came and noticed that I wasn't right. And I ended up having retained products back to the OR. Yeah. I was transfused multiple units of blood and hospitalized for several weeks. So in that moment, I almost became a statistic because I wasn't believed. I wasn't listened to because I didn't look like what pain is supposed to look like or with that box. And so that's why I'm just grateful to have this conversation. And it was. And it shows that it goes beyond access because people will often say it's an access issue. But no, I had the most access in the world. We've heard of celebrities, Serena Williams, all kinds of people. And it's going beyond that. Your perspective. And we talked about this right in the beginning, Tina, where if your perspective of what pain looks like or what something looks like is not diverse, you're not able to take you're going to miss it. And it's critical that all parties in the healthcare system know beyond what they normally see, because you never know what might come in, and you need to be able to assess everybody, all skin tones, all backgrounds, everything.
Absolutely. And for any healthcare provider, anytime somebody says, I don't feel right, that should be like a red flag, like an immediate red flag. Because you don't know how they feel inside. And I remember we took a class at A1 at the conference for labor and delivery nurses, and they were going through charts of people that had really bad outcomes. And usually one of the first complaints was somebody saying I don't feel right. I don't feel good, and you're like, oh yeah, but your blood pressure's good. And because we've seen this too, where maybe your bleeding is okay, but maybe there was a big blood clot that was blocking the path. And then eventually what happens is that blood clot will come out. It's humongous. It can be like a uterus shaped clot. And behind it, you're just hemorrhaging. So you're just getting worse and worse and worse. But because there's no outward bleeding, you're like, and maybe your body is doing well. It's compensating. Your heart's like, I got this, hang on. And then eventually your heart's like, I don't got this no more. And now you're in a world of trouble. And now you're playing catch up as opposed to maintaining. And luckily for you, you had that contact, you had the ability to connect with somebody to be like, I'm not being taken seriously. But for a lot of our Black moms, that's not going to be the case. And then these things are being caught later and later. And then it's harder to help these moms out and get them back to a healthy standing.
Well, just the sentence structure of I don't feel right should be enough to push that person to honor that. And that's where the language, for me, I share with my patients and online,
Mhm.
it's instead of saying, I don't feel right, be descriptive.
Mhm.
I am feeling extremely tired. I have
Yeah.
never felt like this before. And I know something's wrong. And I would love to have answers to why this is happening
Mhm.
because when it's vague, sometimes in clinicians, to your point, it's like, well, this looks
Nah,
good. This looks fine.
yeah.
All of the
Well,
things
yeah,
look
of
fine.
course. You just had a C-section. Of course you don't
Yeah.
feel right.
Right. And that's what was
You're
told. They're like,
pregnant.
this
Of
is
course
what
you
you're
don't feel right.
right. I was told this is how you're supposed to
Oh,
feel. And
yeah.
I remember sitting there thinking like, I know something's wrong. I
Yeah.
know
Yeah.
I don't feel
Yeah.
right.
And
Uh,
could you just feel it like fading? Like, were you able to like sort of see your life like moving farther away from you? Like knowing the statistics, knowing that Black women are more likely to die in childbirth, like that would be really frightening to be aware of that statistic and then know that something's not right and know that you're not being taken seriously. I'm
I
sorry that
knew.
happened.
Thank you. I knew
Mm-hmm.
in that moment, like that statistic came like
Oh,
a lightning bolt across my mind. I was like,
yeah.
this is what's
I'm gonna
happening.
be, yeah.
And when I share the story, although it strips me from the inside and I can feel it as if I was
Mm-hmm.
right there. And what happened, I do it because I want to
Yeah.
help and I want to help
Yeah.
someone else hopefully not have to do it. But
Mm-hmm.
yeah, it was the most terrifying experience. And when you think of birth trauma and how that happens, and we talked about
Mm-hmm.
how that curtails your future deliveries, like the
Does, yeah.
fear of having another baby.
This is going to push more and more women into home births and free births where maybe they aren't really a candidate for a home birth or it's not safe for them to have a home birth or they don't want a home birth, but they're like, I sure as hell I'm not going to go in there again. Like if I had a baby in my pants and I still wasn't taken seriously, like how is my health and well-being going to be taken seriously? And just it keeps adding to the cycle. And it's like, how the fuck do we get out of this cycle is like, ugh. Let's all repeat after me. My symptoms have changed. I need you to check again. Write it down.
Yes. Yes. And continue to say it over and over.
Yeah.
And for the person in the room, like I gave the example of my husband, and I'm mindful that not everybody can have
Yep.
their doctor's number in their phone. What would you say if there a situation like mine or a complication? We
Yep.
talked about using the voice when your partner's voice isn't. How could that
Mm-hmm.
loved one, that partner, escalate the situation in that moment? What would you give as far as advice?
Knowing a few scripts ahead of time can be really, really beneficial. You have to ensure that the support person that you bring with you is the right one. And I say this like with love in my heart because unfortunately we need people who are strong-willed. And I always say people are like, well, it's my husband. And I'm like, I want you to know, like, it's not always the person who made the baby who makes the best support person. Hiring a doula can be really beneficial. And not only hiring a doula who's like culturally aligned, making sure that your midwife or your OBGYN is known for equitable care if these are concerns for you specifically. Having those scripts and ensuring that the person who is going to be delivering those scripts is able to do so. They really need to check in before the fact and be like, if shit gets real, can I do this for you? And if the answer is no, then you need somebody else in that role. I would say document everything. I am like now more than ever, I'm okay with people. I mean, I don't really have a problem with people recording me because I sort of feel like I'm doing a good job. I don't know. Like I don't know. I'm like, I don't have anything to hide. Yeah, you can film me. It's great. But I think like recording people, unfortunately, is starting to become something that seems necessary when you know that these two viral videos are examples, but we know that this has been happening forever that haven't been recorded. And I think to remembering this script of like, I'm concerned about my safety. I would like this documented in my chart. That I think is something that everyone should be saying out loud, because I think not only does it remind them that they need to be documenting it in the chart, that they were like, hey, I know something's not right. I think it also is like a reality check for them and be like, oh shit, you're right. I need to take this super seriously. And it's unfortunate that we need reality checks, but I mean, you're going to come across shitty nurses. You're going to come across shitty OBGYNs and midwives. Like, unfortunately, it's part of the package. But like, I think if you can do something to try to really secure in that success for you specifically, so that you can walk away from that experience feeling like it was beneficial and it was satisfying and it was a nice birthing experience for you specifically, then that can go a really, really long way. And I want people to do everything that they can to try to make that happen for them.
So, if you could wave a magic wand
Mm-hmm.
and change anything about how hospitals approach labor and delivery
Mm-hmm.
to make it more safe and equitable for everyone, what would
Yeah.
it be?
I would make it less cookie cutter. I think again, we have sort of lost sight the forest from the trees. Like birth is supposed to take a while. Birth is supposed to be a process. It's not something that is supposed to be micromanaged by human beings. I will still give birth. If I had another baby tomorrow, I would still give birth in a hospital. I would change some things though. I would probably go with a midwife, because now that I am doing more research on what I would do if I had another baby, a lot of them maybe aren't OBGYN focused. They're more midwife focused. And that is a whole other conversation for another day. But midwives definitely have a place. I want people to know their options. But I think that the cookie cutter of like, we need to break your water. Okay, we need to get you more contractions, without really taking in the overall picture. And I'm not saying that you can't have a beautiful hospital birth. You really, really can. But I think unfortunately, it seems like it's turning into more of the norm to sort of push things forward as opposed to stand back and let things happen. And like, sadly, a lot of times it comes down to like census and patient load and your staff ratios. And so sometimes things get expedited. So that's why I say like, preparation before a birth, it can go such a long, long way in you feeling like you know what to expect, and you know kind of what you would like out of it, and the ways that you can try to steer it in the direction that you want it to go with a grain of salt.
I love it. And I'm going to now answer the question that you had asked earlier about what can we do. It's about going beyond the viral video, and you know where I'm going to go with that. And that is highlighting the programs that are doing it right.
Excellent.
And that's like Birth Fun. We know there's so many groups out there that are getting it right. And that's a way to help fix this situation that is happening to Black moms every single day. So looking at the systems that are making it happen and putting those safe births out there is a real way to help people. And so that's my hope, because with the outrage and everything that has happened with these conversations, my request is, let's go beyond sharing that video. Let's talk about the people and advocating and uplifting the resources that are there and help them. So that was my long-winded, but that's my answer for right now, because the system is fractured, but it's all about what you can do, and people are doing it right now. They're helping people.
And I think we have to not forget those viral videos, like when the views have gone, like it's going to be an ongoing issue. The other thing I'm going to put out there is, if you are a medical content creator, especially if you are in the labor and delivery space, especially if you are a white content creator, please use your platform to raise up these voices. I know several Black advocates for moms, and they always say to me, like, it's so helpful, because for some reason they'll put a message out there on their platforms, and a lot of times they're met with a lot of messages like, all moms matter. And they're like, oh my God, you're missing it. But I think when white people do it, it's like, I don't know, for some reason, unfortunately, it seems to reach. And so if that's one thing that I can do, like, I'm happy to keep doing it. So let's just keep the conversation going.
And you're doing it well. And that's why I really honor and I cherish our friendship, because you see it and you put action behind it. And so, thank you for that.
Oh, thanks for sharing your story.
I'm going to give you a bigger hug next time I
see
so
you.
Sweet.
If you guys ever have a chance to meet her, go meet her. She's just the sweetest.
I appreciate it. Well, Tina, this has been such an empowering and necessary conversation. Thank you for giving us all the knowledge and confidence to walk into birth experiences more informed. There are so many other angles to this conversation that we could have gone, and I love how we narrowed in and we focused, and you shared beautiful insights that will help anyone who is about to give birth. So for those who want to dive deeper into these topics and really prepare for birth, I want to share that Tina has an amazing website where she offers prenatal care, breastfeeding, and baby care course on our website at bumptolatch.com. And it gives you the kind of preparation that I think every person needs to have. And that is even the person who's watched all the YouTube videos. I promise you go to our website, you're going to learn something new. You're going to feel more prepared before you deliver a baby. So you can also follow her on YouTube, Instagram, TikTok, Facebook as Mama Nurse Tina. So where she continues to share evidence-based information with her signature humor and realness.
Maybe one day, maybe one day they'll see us on stage together having a.
I would love that. I'm
Yeah.
all in. Let's do it.
Let's nail it.
Well, I guess my last question was, any final thoughts?
I think we just need to keep talking about this. And I
Yeah.
think those comments are going to come in. All moms matter. Yes, they do, but this is a problem. It is it's not an opinion that Black moms are more likely to die in childbirth than their white kids. It's not an opinion. It's a fact. So it's time to be like, okay, it's a fact. Let's get there.
Let's do it.
Yeah.
Did something in this episode click for you? Share it with someone who needs to hear it too. Because here's the thing. The more you know about the birth process and your rights as a patient, the better you can advocate for the safe, respectful care your baby deserves. You've got this.
So cute.
Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.